Hi guys. So I want to pursue occupational therapy once I graduate UMaine and get through grad school and everything. So occupational therapists deal with behavioral, cognitive, intellectual disorders and disabilities more so than any health professionals other than psychiatrists, really, or maybe neurologists too as well. But as an occupational therapist, you deal with how that person is going through their activities of daily living, whether it be um, intellectually, adaptively with how they function, whether they're recovering from an injury or a trauma or things like that. So it's very relevant for an occupational therapist to look at different types of behavioral, cognitive, intellectual, etc. disabilities and disorders. And the DSM-5 does a really good job of laying out the criteria and kind of the classifications for things like that. So I'm sorry. Um, so with this, there's two different types of reactive attachment disorder, disinhibited versus disinhibited, and you can read that for yourself. And what reactive attachment disorder is that it has its roots in pathogenic care at infancy. Kind of looks like a child was neglected in their very young years, and that's usually seen in kids who were adopted or who were in foster care systems. So it's very important with this type of disorder that you build trust with this individual because they were neglected as children or were moved from situation to situation, and they had no trust with their caregivers, or they knew so many that they didn't know where to put their trust in. So it impacts the future very much so, as well as the present whole person. So this video kind of looks at parenting a child with RAD, and there's some key teaching strategies, not only with RAD, but with many of the disorders that are classified under behavioral and as well as intellectual. So these are really good to look at as well. So that was super quick, but I appreciate your time. Thank you very much.